Thanks. Let's bring in Josh Jennings, Managing Director, Senior Research Analyst at Cowen. $572 million to J&J is not that much, I guess, Josh, but it's been pointed out that some of these smaller companies, they see that's a lot to them, and this may induce them to settle some of these other pending cases. Do you think settlement talks will be more in earnest at this point, Josh?
You know, this could be. Good morning, and thanks for having me on. I do. I think this could be a catalyst for some deeper settlement talks. My understanding is that the judge in charge of the multi-district litigation in Ohio has been pressing for a settlement in front of that litigation. It's still unclear. I think Johnson & Johnson said last night that they are open to settlement, that as long as it's on negotiable terms. But this is a relative positive for Johnson & Johnson. Expectations were potentially as high as $1 billion or in the multi-billions. And so for the decision to come in at $572 million, it is a relative positive.
Josh, can you just back up for a second? You've heard that Johnson & Johnson is potentially looking at a settlement, because I thought their whole point was they didn't want to do settlements. They want to make sure they made a point of it. Did they feel like they made their point enough with this, and now they'd be willing to actually say, okay, let's make this go away?
No, that's a great question. Just to clarify that, I think they've just mentioned and stated that they're open to settlement. I think that is relatively new. I don't think that this is going to be a catalyst for them to move forward directly with settlement talks, but that has been one of their comments post this decision yesterday afternoon. So we're not anticipating a settlement, but it does seem like Johnson & Johnson has put the message out there that with reasonable terms that a settlement could be in the cards.
So, Josh, should there be punitive damages here? I'm just trying to figure out the whole sequence of events, because the FDA initially didn't have a strong feeling about how addictive these substances were, and maybe the drug companies didn't know, or did they know at the time? Because, you know, chronic pain or cancer pain, things like that. I mean, a drug company's trying to do one thing in terms of that, and you know, they're trying to meet a patient's need. Did they know for sure that that wasn't going to be the use of the opioids at that point, Josh? And did the FDA know it was going to be abused to this extent?
You know, I like the line of inquiry here, because I think one of the fascinating elements of this case in Oklahoma is that J&J was on the hook for the total abatement program. If you think about all the layers of responsibility within the whole chain, everyone from the manufacturers to the distributors, to the pharmacies, to the physicians, to the FDA, to the politicians. I was a practicing physician as a resident in 1998 to 2002. In my intern year, I knew that opioids were addictive. So I don't think anyone in the healthcare community can honestly look in the mirror and say that opioids weren't addictive, that it wasn't known clearly. All you had to do was practice in an emergency room. I did analysis back in the mid-2000s when I was working mostly through emergency rooms. 40% of my patients were coming in seeking opioids. It's one of the reasons that I left clinical medicine, actually. So I think the fascinating element of this case is that Johnson & Johnson was put on the hook for the entire abatement program. If you also look at the settlements prior to the case with Teva and Purdue settling for $350 million, you have Johnson & Johnson paying for the first year of abatement the full boat of $572 million. So that math doesn't clearly add up. I'm not a legal scholar or legal expert by any means, but we think there are some holes there. Johnson & Johnson is going to try and roll it back through the appeals process, and that appeals process won't end, at least through the Supreme Court of Oklahoma, until 2021. So they're not going to be on the hook for this specific penalty for a couple of years.
Yeah. So even the FDA. I mean,
potentially. Again, I mean, I think the initial label for OxyContin was that implied that there was less.
Josh, did they not know they were going to crush it? I mean, what's the best way if you're an addict? Do you just take the pill, or what do you do with it? You crush it up, or did they not know it was going to be abused that way or something? Or?
You know, I think there may have been some misunderstanding about the potential to crush it up and use it in other forms besides oral ingestion. But I think, you know, the long-term of plasma levels of opioid with the controlled release OxyContin, those cause some addiction problems, clearly.
It's a slippery slope for people that, Josh, thank you, for people that have pain.
Yeah.
I broke a couple of ribs, and pretty good drugs, those things. They are. You feel,
You get addicted in like 3 or 4
you
days.
can
It's crazy.